outbreak of a mystery virus in China that now has the World Health Organization on edge. At least 4 people have died and hundreds more are sick, though there are concerns 5 times as many people could be.
We have not seen a significant increase in anything. We hope to keep it that way. The other thoughts that we've been discussing.
So we studied the previous pandemics, and at some point in time in our school, through history, world history, U.S. history, we all studied that. But never once did we think, hey, we were going to be impacted to the level in which we were. So I remember very early on when COVID and you started seeing the coronavirus symbols on TV, you started seeing that and it kind of caught your attention. But this was something that was on national news. It really hadn't hit local yet.
The risk to the San Antonio public remains low, and I want to stress that the individual has been quarantined since arriving at Lackland Air Force Base from the Wuhan province in China, and the individual remains in isolation in a local hospital. Of the 91 passengers at Lackland, this is the only patient with symptoms at this time.
How are we going to staff for this? How are we going to train for it? Is this, very similar to a previous SARS, virus? Is this anything, like the avian flu, stuff that we've at least responded to before? But there was very little that we could pull from previous pandemics. EMS didn't even exist back then. So the industry wasn't even there. The fire service was, but the EMS side was not. So pre-hospital medicine, how was that going to change? How were we going to integrate, into the hospital systems? And we are in one of the, if not the strongest, healthcare regions, in the state and in the nation, where we prepare together, we work together. But how were we going to interact with something we had never seen before? And that was some of our concern very early on into it.
The medical officers, the medical captain, myself, and Chief Montgomery have been influential in ensuring that we try to keep our personnel as safe as possible, and at the same time not taking away from the manpower needed to protect our citizens.
There has been some challenges associated with COVID-19 in regards to learning new ways to do patient care. As the virus really threw us for a loop, threw us a curveball at the very beginning, we had to adjust our clinical strategies to where things that we would have normally done to take care of our patients in the beginning, we learned that weren't the safest thing for us, nor was it in the best interest of the patient. So learning medications and how to give them in different ways, learning new ventilation strategies to help our patients breathe.
So that we did is the decontamination response. So working with San Antonio Fire Department, of course, we worked to decon multiple units in the region. We also took on that responsibility at our own station and have maintained that since the beginning of the COVID response, and where we have personnel that are dedicated to doing nothing more than decontamination of the units after a suspected or confirmed response, or decontamination of personnel in the equipment as well as the stations. And so there's a process, everybody's been trained on it within the department. It's a 24-hour-a-day operation, and so those units are routinely being cleaned. So if there's ever a transport of a COVID or a COVID-like or a suspicion of a COVID-like person, that unit is immediately taken out of service, decontaminated before it's placed back into service.
Now to that explosive new wildfire in Southern California. It's being fueled by ferocious winds, including a gust of 95 miles an hour. Tonight, it is raging out of control, threatening homes, and at least 2 firefighters are
Overnight,
injured.
Hurricane Laura slamming ashore as a monster Category 4, punishing the Louisiana and Texas coast with winds up to 150 miles an hour.
With much of the nation reeling, this is what it's come to in El Paso amid a relentless COVID surge.
So our department's part of multiple deployment teams, both on the fire, medical, and incident management side. At one point during the COVID response, of course, we had personnel that were located in San Antonio. There were personnel that were located in hot spots around the state. At one given time, though, during wildfire season, not only did we have that, but we also had a hurricane response going on. So we were able to deploy personnel to the coastline. We had individuals deployed all the way out to California. We had vehicles deployed out to California. We also had equipment and staff that were deployed along the borders in Texas, borders of Texas and Mexico, all at the same time.
In a normal year, our department wants to be involved with those kind of large statewide operations. When we talk about a normal year, normally it's a hurricane here and there.
Our department's really done a fantastic job of stepping up and answering the call around the state supporting our region with STRAC and the Emergency Medical Task Force under the state of Texas.
This year obviously has been much different. This has been one of the busiest years I've ever seen for deployments. So we've been fortunate enough to be able to assist in not only Hurricane Laura in Beaumont. We sent 2 ambulances for a strike team and a few medical incident support teams.
We've had the opportunity right now to help out our fellow Texans, not just in our own community, but all over. Myself, along with other members of the EMS division leadership and several of our frontline paramedics this year, have deployed all over the state for several different types of contingencies.
But we've sent ambulance strike teams to Laredo. We've sent medical incident support teams to El Paso, Del Rio, Eagle Pass, and we've also done some local support missions.
Not just the COVID-19 pandemic, where we helped out with critical care transports of sick patients in Laredo, Texas, and assisting staffing the mobile medical unit in El Paso, but also hurricane deployments. We had teams working here locally at the Freeman Coliseum to help shelter patients, people displaced by the Hurricane Laura, and then forward operations with some of our crews assisting in Beaumont and Port Arthur. So it's been a great opportunity for us to step up and help out our fellow Texans in need this year.
Right now, currently, we have a couple of the medical incident support teams working in a statewide coordination center to be able to aid Texas in moving their patients around to different hospitals and things like that. So I definitely think we've made an impact not only locally, but throughout the state through those kinds of opportunities, and being able to get our medics out there and be able to do those things throughout the state has been really awesome. And this has been a busy year for it.
Managing these multiple, deployments while also being able to maintain, the response without any ill effects, really shows the ability of not just our response, but our department, but also of our personnel and our leadership to ensure that happens.